Welcome to today's media briefing. Today we have Dr. Chen Shekwan, Head of Communicable Disease Branch of Center for Health Protection, and Dr. Sarah Ho, Chief Manager of the Hospital Authority. And Dr. Chen will report on today's situation. Good afternoon. And last night we confirmed 2,071 confirmed cases. There are about a dozen of imported cases, 19 to be precise, from a flight from Indonesia, and the rest are local cases. And so far, at this moment, we have 4,500 preliminary positive cases. The Public Health Laboratory from the Center for Health Protection currently we have over 1,000 positive cases that are still pending. So therefore, the yesterday confirmed cases figure should be higher. Of the 2,071 positive cases, 32 of those are from L425R multivariant, and 1,927 are suspected to be Omicron cases, and about 110 of those are indeterminate. In terms of elderly home, we have some reporting cases or having outbreaks, including in Sam Chimpo, Lion Estate, Hong Kong, YWCA, Wanhua, an elderly home. And they were tested positive from rapid antigen tests in Tuen Mun Tai Ing Estate, the neighborhood association Tai Hing hostels. There are some positive cases, and some tested positive from rapid antigen test, and quite a number of residents will need to be quarantined. In Prince Edward, in Chinese Hawaii, there are some preliminary positive cases or positive from rapid testing. Well, the more cases are in fact in the first floor, and they will need to be quarantined. In Tuen Mun at San King Shopping Center, in Chinese Guanyik San Ging, there are some preliminary positive cases. In the A2 zone, the residents there we need to be quarantined. In Shatin, NAAC, Yansanjiang in Chinese, there are some preliminary positive cases, and some of the residents are tested positive from rapid antigen tests, and we are following up in Chou Kwa Wan and Chinese Xiuqing on Lo Yun. There is a case here. We are still waiting for the results from the other residents. We'll keep this in view. In Sam Triple Polion Cook, an integrated rehabilitation center, there are some individuals having fever, and some tested positive from RAT testing. We are still waiting for the lab report. We're following up. And there are still other cases from the elderly homes. And the public mortuary, there were some individuals who were elderly that passed away before arriving in the hospital, and they were tested preliminary positive, but then admitted. I have 2 cases at hand. There's a case confirmed today, 33-year-old male living in a Quang Tin estate. On February 13, he passed away. and tested positive. I do not have the details. Another preliminary positive case on February 14th, and he had a coarse voice and a cough for a day, and he deteriorated and called an ambulance and passed away before arriving to the hospital and lived in Yangma-Jie. 77 male. I do not have the details. And that's the end of my report. Now, have the Dr. Sarah Ho to talk about HA situation. Currently, we have over 3,600 confirmed cases and preliminary positive cases in our public hospital, North Lantau Infection Control Center, and the Infection Disease Center, Asia World Expo Community Treatment Facility, on Penny Bay Community Isolation Facility for treatment or isolation. A 77 male patient on the night of 12th of February and who went to the observation ward in the Eastern Hospital due to shortness of breath, and he was diagnosed preliminary positive. He continued to deteriorate and passed away at 4:50 a.m. An 82-year-old male on February 11th, and due to fever, was sent to the Princess Margaret Hospital and tested preliminary positive. His condition continued to deteriorate and passed away at 2:17 a.m. this morning. And for the 3-year-old girl tested preliminary positive, she is still staying at a children's hospital in a critical condition. And 9 patients are in a critical state who are confirmed cases. And after some compiling over the past 2 days, on Saturday, we have 280 patients discharged. And yesterday, there were 300 patients discharged. And for the past few days, the number of discharged admissions were huge, such as we might need to revise these figures later. And currently, the utilization of the isolation bed in the hospitals has reached about 90%, which is the upper limit of our capacity. I hope that we all understand that our isolation beds cannot reach 100% capacity. We must have some reserved. Let's say after discharge, we need to sterilize the beds or for urgent cases admission. For the past week, in each day, we have over 1,000 confirmed cases daily, and some of the patients are waiting to be admitted in the community or waiting to be entered community isolation facility. We healthcare workers feel anxious as well. We hope that we can admit all these patients and hope that the public can understand the challenges we are facing as the number of caseloads rises quickly. Therefore, we must give priority to serious cases, the elderly, and children. We must allocate the services to these most in need. As for the patients waiting admission and those in a stable condition, we're trying very hard to come up with other ways to help them. For example, we would try to add more isolation facilities, and we are now preparing to open dedicated clinics. We hope for their understanding.
We also step up support for people waiting to be sent to hospital, and we're operating a hotline. Besides the current hotline in operation, our colleagues will take the initiative to call needy patients to understand about the situation and provide support. And on top of that, HA will add a support hotline for COVID-19 patients waiting to be hospitalized. And this hotline is dedicated to preliminary positive patients who have inquiries. If they have any medical or infection control problems or questions, our medical staff can, through the hotline, provide support for them. And also, we hope you can actually rest assured that your need will be met. And this hotline is intended for preliminary positive patients, and we do hope that there will be a big need for such support. So I call on other confirmed patients to make use of other channels to find out about more information about the pandemic, for example, through government notices or the dedicated websites. And the hotline I just mentioned is supposed to be reserved for the preliminary positive cases. We'll announce details later on, and I do hope that the public understand that we are actually handling a crisis now. So we hope that we can join hands, strive together to support our medical staff, particularly the frontline officers who are now fighting a battle in the front line, and we hope that we can all weather the crisis. Today, we've got about 40 staff who tested preliminary positive. Most of them actually were infected in their homes or actually the community. About 20 staff will be classified as close contacts. And we also got about 10 patients during screening at hospital and were found to be preliminary positive. And also we have another about 50 patients who will be classified as close contacts. And we are compiling the data concerned, and later on we will release them in our press release to be issued later. That's the end of my report today. So it's now time for Q&A. Please raise your hands and use the mic passed to you. Before you ask a question, please tell us which media outlet you're from. This one in the third row, this lady in the third row. Phoenix TV. I'd like to ask about the number of confirmed patients who are waiting at home, waiting for instructions from the Center for Health Protection, and how would you decide who will be given priority in being sent to hospital? And just now you mentioned that there will be dedicated clinics for people who tested positive. How many of them there are, and would you consider organizing online medical consultation? And are there any new arrangements for children patients? And also some people have mentioned that even where they are, there have been cases of confirmed patients, and yet they haven't seen any notices for compulsory testing. So for the are there any new criteria for the issuance of compulsory testing notices? First of all, in the past few days, every day we've got more than 1,000 cases, and the situation changed quickly. We keep having people being confirmed and hospitalized, and we have also need to arrange for recovered patients to be discharged. So I can't give you any actual data now, but our colleagues have been working 24 hours, and we believe that there are more than 1,000 patients waiting to be hospitalized. But let me assure you now, the Department of Health, HA, and the Fire Services Department, all their staff have actually thrown their support and used all the resources for getting people to be sent to hospital. We must ensure that our emergency services and medical system would not collapse. And we also assure that those in serious condition, like the elderly and children patients would be given priority. And if we cannot arrange for patients to go to hospital now or to be sent to community isolation facilities, we do hope they can understand that. And for people waiting in the community, as I mentioned just now, we are aware that some patients, while they're waiting, they have access to a hotline through which our staff will provide support for them. And in the days ahead, we're going to open a telephone hotline for waiting patients. If they have any questions about their own medical condition and infection control, they can call the hotline and get support from our staff. I also know that for some patients, they may very much like to know what special consideration should they make. As I said, they would be given support through our hotline. But let me say this here in particular. If a patient's condition gets worse, or if they have difficulties breathing, if they have high fever for a long time, or muscle spasm, or the lips turn purple, and if their heartbeat actually increases, or if they become half conscious, then the family members should call the ambulance immediately and send the patient concerned to A&E unit. And we will actually particularly pay attention to patients with special needs and whose condition has deteriorated. And for compulsory testing, earlier the queues were long, and we also want to concentrate our resources given the large number of cases. So we want to concentrate resources on areas where there are outbreaks or buildings with more than 2 units infected. And only for those buildings will we issue compulsory testing notice. But anyone who feels that they are in a high-risk area, they can go for testing. But it's just that we want to concentrate our effort now on high-risk places. This person in white. I'm from Now TV. Just now you said that in Shamshui, Fu Hong Society Center has some living students who tested positive. And some parents are concerned that because these students have not been sent to hospital and they may be stranded in the same confined space. And just now you said that you give priority to children. So why is it that these students have not been sent to hospital yet? These students at the Chok Yan Center. And just now you mentioned that the 3-year-old girl is in critical condition still. It said that no other treatment could be applied in her case. Can you brief us on her situation? And there are also 2 elderly persons, as you mentioned, who were found to be preliminary positive after the bodies were sent to the mortuary. Can you tell us when the 2 elderly person called the ambulance? When was that? And how long was it between when they called the number and when they passed away? Is it possible for them to have died because of COVID-19? Is there any relevant analysis available?
For the home exam poll, we're following up as these were rapid test reports. They are not being preliminary positive yet, pending further testing. For the details of the 2 persons picked up at the public mortuary, I don't have the details. You may need to go inquire the authorities. For the 3-year-old child, her condition deteriorated rapidly, and currently she is staying at the Children's Hospital ICU for treatment. So that's her situation now. The healthcare staff will try their best to support this patient and her family. The next one, and the second last row. TB News. First, I would like to ask the hospital authority. We see that for the HA staff vaccination rate, the staff will need to get vaccinated for at least 1 dose before Wednesday. How many staff are still unvaccinated? Do you have a figure? If by Wednesday, if he or she not able to get vaccinated or without reasonable excuse or not getting a medical exemption, would he or she be terminated rapidly? By terminating these staff would add more staff pressure to the HA. Just now, it was mentioned that you will set up a hotline for those waiting to be admitted. Can the HA take a step further to clear the backlog outside the A&E departments? Well, a lot of the preliminary positive cases and those tested positive from RT tests are still waiting outside. Is there any way to reduce the crowd waiting outside? Or can they leave home after registering or use telephone to confirm with them? And thirdly, and for the number of preliminary positive cases for the past few days was larger than the confirmed cases. And how serious is the backlog from preliminary positive cases to confirmed cases? Had the CHP do not have to catch up due to the large number of preliminary positive cases? Let me first add a question on the preliminary positive cases first. The CHP laboratory that last night became overwhelmed, and therefore more reports will be issued today. Thus, the figure will be reflected tomorrow. However, we will not separate preliminary cases and confirmed cases. We'll deal with the cases as they arrive. We'll keep admitting them. As for the status where they are preliminary or confirmed cases, well, there will be some time lag. And from the February the 16th, HA will implement the vaccine pass to be in line with the overall epidemic strategy. And hopefully to reduce the known risk of infection in public hospitals. That all the HA staff must show proof of vaccination before they can enter HA facilities, which include our offices and hospitals and clinics and other related facilities. And all the frontline staff must complete 2 doses of vaccination for 14 days or more. The other staff must at least receive 1 dose, and each cluster shall assess the exemption certificate to see if they're compliant, and depends on individual circumstances and based on the usual HR procedure to conduct follow-up. And for the overall vaccination rate of HA has now exceeded 98%. Next, the gentleman in the gray jacket. In media, on the vaccine pass, you claimed that 98% of the staff are vaccinated. But how many staff you estimate could not come to work due to no vaccination? If they could not come to work, would that be equal to termination? Would it affect the morale and the manpower? For the Department of Health, we received a complaint that a non-living family member was confirmed. However, they could not confirm if they're close contact, but no one picked up the phone at the hotline. Well, do you have enough manpower to work on the Stay Home Safe program? How do you determine a close contact? If you cannot arrange the patient to be admitted, can the public determine themselves as close contact? If they couldn't decide, and yes, they're asked to work by the boss, and what can they do? What the government continue to considering to have a larger scale lockdown by dividing Hong Kong into 20 districts. Can you confirm this? Besides the telephone hotline, can you provide more support for home isolation? Let me first answer the question on close contacts. Well, we're trying to stop the spread. Well, for those people who spend time with family members, and they will be considered close contacts. Since there are so many cases, we try to arrange them to be admitted first. Well, to the hospital and the isolation facility first. Well, if the public do not receive a phone call, that means there's a chance. If you have a living family member confirmed that it must be a close contact, if they are not sure it is safe to regard themselves as close contacts, and they should not leave home. If probably we had a meal like a week ago or just quite some days ago, well, there's relaxed likelihood of being infected. Therefore, we will not regard them as close contacts. And previously, when we have less cases, we want to trace the source. Maybe we'll try to trace those contacts 14 or 21 days prior as close contact. Now we're trying to stop the spread. Thus, for the confirmed case, the likelihood of infection during the infectious period, we'll try to keep them in quarantine. Well, now we have over 98% of our staff vaccinated, and about 1% of our staff can provide for doctor certificate. And for the unvaccinated, once again, I appeal them, they should be vaccinated to protect themselves and our patients. Let's take an English question. The final row.
From the SCMP. First two questions for Dr. Chuang, the last one for Dr. Ho. So first question is, do the 2,000 cases confirmed today reflect the actual situation right now, or is there a lag between reports of preliminary positive cases and confirmation done by the DH lab? Should we start counting positive results from private labs as confirmed cases, yes, instead of waiting for the DH lab to confirm infections? Second question is, by cutting the number of compulsory testing notices issued and therefore the possibility of identifying more positive cases, is this simply delaying the inevitable as the spread of the virus cannot be contained this way? And for the HA, currently how many HA beds are reserved specifically for pediatric COVID-19 patients, and what is their latest occupancy rate? When was the earliest report date of COVID cases that haven't been admitted to hospital yet? And among them, how many children have tested positive and are still waiting to be admitted? What is the average waiting time for hospital admission among pediatric and elderly patients? Thank you.
As I mentioned in Chinese before, around 2,000 cases has been tested positive by a laboratory, confirmation. But we have around 4,500 cases in hand who are preliminary positive. So we communicated with our laboratory and understand that maybe 1,000 to 1,500 cases, specimens, that may be duplications, that should be tested yesterday, but there's a backlog. So we expect those specimens will be confirmed today, but because of the vast amount of specimens and tests being done, so there is some delay in the confirmation of the specimens. But we will treat all preliminary positive cases as cases and arrange them for admission. We won't wait for them to be confirmed, but still the waiting time for the admission is still, there is still a bottleneck on that. So we are still, at this point, we are still we still need the public health laboratory to confirm the test. But of course, we will monitor the situation and review the practice from time to time. And for the compulsory testing notice, we would like to concentrate on those areas with outbreaks, or I understand there's also some compulsory testing notice according to the sewage findings. So, but the other publics who think that they are still at a high-risk area, or they have been to places where they know they have confirmed cases or so on, they are, of course, they can go to the testing centers for test.
For the pediatric cases, actually we have pediatric ward and adult ward, but that absolute number is not a good way to manage the demand. In fact, we have extended our admission of pediatric cases to different units and flexibly deployed our staff with pediatric experience to take care of those in need. So that's why we have pediatric cases not only in hospital, but also community therapeutics unit like ICC and also Penny Bay. We deploy our staff with pediatric experience, and pediatrician has been deployed to Hong Kong ICC so that to facilitate the admission of those in need pediatric cases. As the number of admissions increased potentially in last few days, I did not have the waiting time information on hand.
下一位，嗰邊尾二個行中間白色外套嗰位先。
Next one. I'm from Kipo TV. I'd like to know the government's capacity in carrying out tests. How many tests can you do a day? And also right now, for people under home quarantine, how many of them are having home quarantine now? Yesterday you said there are about 4,000. So would you have an updated figure today? And also right now in the community, there are some preliminary positive cases. and who have not yet received home quarantine order, how many of them there are? And for some confirmed cases who are having home quarantine, if they have recovered and yet the government has not asked them to go for final testing. So what can they do for these people? Should they just remain at home? Can they go out? Or should they keep waiting for the notice from the government? For capacity to carry out repeat testing, I don't have the actual figure, but I know that the public government laboratory has tried their best to try to ramp up their testing capability and also do the testing more quickly. And they're now figuring out ways to try to ramp up their capacity. For people under home quarantine, the number is 4,730. That's the figure by last night. Preliminary positive cases? You mean those who've remained in the community but have not received home quarantine orders? If they are preliminary positive, they should not be given home quarantine. It's the family members of the confirmed cases who would receive home quarantine order. For the preliminary positive cases, they should go to hospital or be sent to quarantine facilities. Sorry, the speaker is not using mic. At this moment, our preliminary cases number more than 4,000, and together with today's confirmed cases, which number more than 1,000, so all these people, well, there are other cases still under investigation, and so there will be people who have not yet to receive the quarantine order. But if you add, you can look at the number of preliminary positive and positive, so you know there are, I'm saying that there will be thousands of people who are family members of these cases. And for those who are confirmed cases, they should be isolated, either sent to hospital or go to isolation facility in the community. And of course, it has exceeded our ability and our capacity to provide such isolation facilities to them. So we are now thinking of ways to expand the isolation facilities. So our colleague from HA has talked a lot about our measures on hand. Would you like to supplement? Yes, we do hope to expand our community treatment and isolation facilities so that patients could be put in community isolation facilities as soon as possible. This one?
Questions from RTHK. So about the designated COVID clinics, where are they and when will they begin operation? And can people get medicines there? And with more than 2,000 cases reported today and another 4,000 to come tomorrow, do the authorities have enough manpower and resources to support those who may not be able to be admitted to hospital in time? And as there are more young children being infected these days, how many of them are in critical conditions, and how do you assess the risk of children being infected? And will you encourage them to get vaccinated as well? Thank you.
So I answer the first question first. And I understand there are quite a number of people, preliminary confirmed, are still staying in the community. So that's why we try to enhance our support. Previously, we have a patient support call center. The staff will call those confirmed cases and preliminary confirmed cases, and then provide infection control and clinical advice support. And in view of the need is increasing, we are going to set up a hotline that the patients can call directly through the hotline to our staff to inquire about infection control questions or some clinical questions related to COVID. And we are also exploring to set up designated clinic so those patients with symptoms can attend the designated clinic. Of course, we are seeing how to support the patient with medication, but the details are still, we are still working out the logistic and details. We will let you know once more information available. For the pediatric cases, at the moment we have one pediatric cases in critical conditions. So I know the vaccination criteria or age has been lowered to age 3 or above. So I strongly advise kids to have vaccination to protect themselves.
下一位，呢邊最後嗰行中間。
This gentleman there. AM 730. Just now you mentioned that you need to make sure that the medical system will not collapse. What is your definition of collapsing? And also for the designated clinic, do you have any information on the choice of location? And also you said there will be an additional hotline. Is it going to be in operation from today? How many medical staff will be on duty? And on an hourly basis, you think how many patients can the hotline help? And also you said, mentioned about definition of close contacts. I'd just like to classify. Is it 2 days before pandemic positive or what? Can you give us a more precise definition of close contacts? And also the visit history, would they follow the practice of 2 days in advance? And also would you consider for some cases that they need not be tested by the government laboratory? Would there be any change in the approach to testing?
關於嗰條熱線呢，其實我哋就喺度準備當中，咁呢希望盡快啟用嘅。
Still preparing the launch of the hotline, and we have further information. We will issue a press release. For the current situation, this is not satisfactory. We hope that the patients with their patient needs will get a timely and appropriate care. And that's what a healthcare staff hope to do, and what we really hope to achieve. We need to ensure that the elderly and those with severe symptoms and pregnant women and children with symptoms, we hope that we can admit them as soon as possible. For cases in general, if they're showing symptoms, and the 2 days before the onset and to the date of isolation for those who are met and have meals together, and they will be classified as close contacts. Well, with less cases, there will be 4 days before onset. And we have very little number of cases. In order to trace them, we're talking about a lot of days before the onset. We're not talking about whether we infect the others. We'll concentrate on the days, 2 days before onset until he or she is sent to isolation. And how do we boost the capacity at the public health laboratory is something we are thinking about. If they're asymptomatic, well, it would be the day of testing, or with the date of specimen was taken. When the specimen is tested preliminary positive, they receive an SMS showing that the specimen was positive. Then there will be the 2 days before he received the on that day. Main Power Daily News. And a question on the general situation. And for the CHP, based on the central assessment, how will the epidemic develop? Is it possible that we'll have a single-day case level over 10,000? Do you see signs of it getting out of control? And I asked HA about those with severe symptoms. And for the critical cases today, are they vaccinated? Are they all elderly? And which mutant strain is it? And for the 3-year-old girl, does she need to be on ECMO? And what will be her treatment plan? And for case number 18733, I would like to ask more details. He or she vaccinated and his or her gender. Question for HA. And for the number of hospitalizations, do you have a breakdown by their site of hospitalization? And now you have 800 person in Penny's Bay. I wonder if you have any update. And for for the statement by the HA employees, you claim that 98% are vaccinated and 1% able to show a doctor certificate. Does that mean a 1% neither vaccinated or failed to show through? If they are unvaccinated by the deadline, on the date of the vaccine pass, they may face disciplinary inquiry or terminated. According to the daily caseload, you can see there's the caseload doubled every 2 to 3 days, and for the 7-day average, there were 898, and today is 1,005. Actually, today is 2,000, and some of these cases were confirmed today, but wasn't included. By this rate, we can't estimate the speed. It seems that it's going very quickly. Besides tracing of close contact and isolation, the public cooperation can reduce the transmission. We observed that many cases had some gatherings during Chinese New Year and had meals together, and these gatherings were quite large in size, like 10 or 20 people, and sat down for many meals. By the time we know that the whole family were confirmed, from these numbers, that maybe it was a tenfold or even a larger increase. By reducing social distance, if we cease all activities during Chinese New Year, that then we may see a drop. However, the number is still rising. And for the critical patient, together with a 3-year-old girl, so far we have 10 patients in a critical state. As some who are unvaccinated, some are vaccinated. They are mostly elderly and those with chronic conditions. As for the vaccination status of HS staff, 98% of staff are already vaccinated. About 1% of those that the doctor had assessed as unfit for a vaccine. For the rest, will follow existing HR procedures to follow up accordingly. I would like to appeal to our staff to get vaccinated as soon as possible to protect themselves and their patients. Speaker on the mic. About 3 of those are vaccinated, the 7 are not. The lady in the last row. Good afternoon, Commercial Radio. Just now you mentioned there will be a new hotline for the confirmed or preliminary positive cases to call. And well, would it duplicating the effort of staff calling the cases, using more manpower while reducing services on others? For this new hotline, do you have a performance pledge? Let's say someone call you and complaining deterioration, or they're coughing or can't breathe, and how much time will pass before you can dispatch someone to take care of them or send an ambulance? If their condition deteriorates, should they call this hotline, or they should call an ambulance to be sent to the hospital? And can the fellow members of the confirmed cases make this call? And talked about lowering the age of vaccination. And it's reported that the phase 3 classes will be suspended again. And how would it help with the number of children confirmed cases? And do do see there should be a target vaccination rate in order to offer protection. I'll talk about the vaccination first. Well, the vaccine takes time to work. Even for 2 doses, it will take time for immunity to develop. By vaccination can reduce the complications and the mortality rate. For Omicron, we may not able to reduce the transmission. Therefore, I hope that the children and the adults should get vaccinated to protect themselves. If we have a high coverage, that we can reduce transmission. And for the patient support hotline or the new hotline, we are aware a lot of the confirmed or the preliminary confirmed cases are not able to be admitted to the hospital or the community treatment facilities. Therefore, we like to take an extra step. We know that they are worried. Therefore, we want to support them. For the first step, the patient support line will call the patients who have been waiting for some time to be admitted. We want to know their latest and provide support. However, some of the patients we need to be support while they are waiting to be admitted. Therefore, we're providing another hotline for them to call us on the COVID-related questions on infection control. They can call us for support. Therefore, we are expanding our support for this group of patients. And we'll also notice there are patients with other needs. Therefore, we'll gradually expand them, including the designated clinics, to reinforce support for these patients. I hope that the patients can wait patiently and rest assured. We'll be trying very hard and we'll do it step by step.
Economic Times, I'd like to ask about, just now you said that there will be designated clinics. Can we have more details? Where would it be? And how many of the clinics would there be? And you said that you would try to increase isolation facilities. How is it going to work out? When do you think enough will be provided to ease the long queue now? And also for Penny's Bay, Asia World Expo, and public hospitals, Tier 1, Tier 2 beds, what are their utilization rate? And for the 70-year-old man who died, and is it the same one who you said found tested positive in the mortuary? As for utilization rate of hospital beds, whether it's in the hospitals or in the overall community treatment facilities, is actually 90% usage. We do hope that we can have more community isolation facilities available. As for the 77-year-old man who actually was admitted to Eastern Hospital on February 12th. His condition deteriorated, and yesterday morning around 4 a.m. he passed away. I think we need to wait for his case number later, and it will be issued in the press release. You can check it. As far as I know, the 77-year-old whose body at the mortuary tested positive, and I think he was not admitted to hospital. So I think he should be a different person from the one admitted to Eastern Hospital. As for designated clinics, we need to find the place, the site, and identify resources, and also deploy staff from outpatient clinics, and have to find people who can actually, handle the work there. So it's very complicated project, but we will try our best and try to overcome difficulties as soon as possible and announce the details to you as soon as we can to provide support for the public. Next one. This lady at the back. Just now you said that there's a backlog of specimens to be tested. Would you consider asking private laboratories to help them? And are you planning to use newly completed public housing estates as quarantine facility? And also for the definition of close contacts, say if for employees or colleagues but who haven't ate together, would they be considered close contacts? Our public laboratory is actively considering ways to increase the testing capacity. On the whole, for company employees, as long as colleagues who have not eaten together, they would not be considered close contacts unless there was a big outbreak at the company. So normally, if colleagues have not eaten together, they would not be considered close contacts. The last one, this man in the red vest. .news. I'd just like to know that given the huge pressure on the local medical system, and you said that you need to increase the number of beds and wards, have you assessed how many more wards and beds do we need to cope with the current crisis? Have you considered getting help from the mainland? That's question one. And also secondly, there are some queries from the readers who went for testing last Wednesday, and yet today he hasn't received a report of his testing. And he called some hotlines, and yet no answer was replied, and he had to go to work. So any advice would you give to people who's been waiting so long for the testing results? And lastly, there are a number of confirmed cases who have remained at home, not being sent to hospital. And they will also undergo rapid antigen tests. So when they do the test at home and the results were negative, what should they do? Should they report back to the HA, or what advice would HA give to people like, that? Maybe I'll ask you on the question on testing report. I know for the CDC, at the CDC, they will give out testing results in about 2 days, 1 or 2 days. That is as a result of community testing. So if they haven't received any report, it could be something wrong in the information provided. So you may need to contact the testing center concerned to see when the report will be issued. You may need to undergo one more test to play it safe. Rapid testing? On the issue of numbers, we have been trying to identify appropriate community facilities so that the confirmed cases can be sent to the community isolation facilities as soon as possible. That's the end of today's briefing. Thank you. The speaker is not using mic. If a building has a number of cases, then it may not be due to vertical transmission. So because there are so many cases in the community now, so we worry about a large number of cases, and therefore we need to see, whether there are any linked cases, and so more testings might be required at particular places. For stay home safe, home quarantine, that's for close contacts, family members of confirmed cases. Preliminary positive cases who did a rapid testing and find a negative result, because they still remain cases, so therefore they should go for formal testing at a quarantine center or hospital, or go for testing at designated clinic to make sure that they have a negative result. Leon Estate, I need to find out more about what happened there. Even though there are many cases there at Leon Estate. But not all the units with cases are in the same position.